and welcome to Local Doctors on Call. I'm Suzanne Lee. I'm joined tonight by Dr. Dwayne Boggess with East West College of Natural Medicine, located on Tamiami Trail in Sarasota. Dr. Boggess, you've been with us before, but we really haven't had a chance to get to know you a little bit. Tell us a little bit about yourself.
Well, I'm actually a military veteran. I joined the military right out of high school. I spent close to 10 years in the military, overseas in different combat zones, actually, which brings us to the topic tonight. After the military, though, I actually started trying to find a way to adjust back into the civilian life, which is very difficult. After you've been overseas and you see different things, you've experienced different things, it's kind of hard to readjust to a normal life, per se. So I went through a series of problems, including anxiety, depression, and what later was actually titled with PTSD. And from there, I started the journey to try and find a way to take care of my anxiety and my depression. I went through many treatments with the VA system, which a lot of veterans are obviously familiar with. So from that route, I was given a lot of different medications for my anxiety, for my depression, and realized they didn't work so well for me. There was a lot of side effects. There was a lot of problems with, even more problems, I guess, with the medications helping me integrate back into my civilian lifestyle.
Is that how you found East West College of Natural Medicine eventually?
It is. It is. I was on that journey. I was trying to get away from medications, anxiety medications, depression medications. I was searching. I was searching for some alternative that didn't take away from who I was, which is what a lot of medications do. When you're going through depression, when you're going through anxiety, you're given a lot of different medications from physicians that take away from who you are. And a lot of times my family and friends would always say, wow, you're just not yourself. You seem very hollow, very different. Your personality's gone. They didn't like the medications, but they didn't like me personally going through my internal battles with anxiety and depression either. So that journey actually did lead me from massage therapy onto alternative medicine, which is where we bring in East West College of Natural Medicine and my journey there.
So that brings us to our topic tonight, which is PTSD. So what is PTSD? Post-traumatic stress disorder. What is it?
PTSD it's a common anxiety disorder that can happen to anybody, from children to mature adults. It doesn't really pick or choose what age you are, but it's a very common anxiety disorder that happens from either witnessing a traumatic, life-threatening event or a series of traumatic, life-threatening events, or where maybe someone lost their life.
So let's be clear, not just the military.
No, it's not just the military. That's anything from car accidents to verbal and physical abuse, especially with small children. You know, we notice that there's a lot of anxiety that comes with maybe an abusive home. I think that's where a lot of counselors come into play, and possibly where a lot of problems happen in the schools. So children maybe seem distracted or anxious or hypervigilant. I mean, those things happen to children, but it can be car accidents, like I said, anything that's traumatic, something that you would witness that's not normal.
So how long has PTSD been around?
PTSD has been around as long as there's been people, and people having accidents, any kind of traumatic events that people were around to witness. So from the beginning of time, probably, up until now, we've just learned over the years how to classify it and put a name on it and then identify it.
Okay. So what are some of the symptoms that either you experience or some of your patients experience where they then have a diagnosis of PTSD?
Well, it's many different things. Everybody's so different, so they're gonna show different signs and symptoms. For some people, it's anger. For some, it's anxiety. For others, it's depression. And then for some, it's all of them, you know, at different times. Hypervigilance is a big one. A lot of people, when I grew up, they were talking about the soldiers coming back from Vietnam and Korea. These were older gentlemen when I was a young kid. Mm-hmm. But they would talk about shell shock. They would talk about a loud noise going off and these veterans being really, really anxious.
Is that hypervigilance?
That would be hypervigilance. It's where you overreact to certain noises. It's where you're picking up every little noise and you're kind of investigating more than you should. Or you're seeing something and you're reading into things more than you should when you can see that there's a possibility of something happening. That's where the traumatic events start to play on our mind. So once we see how traumatic and how bad things can get, our mind sometimes will fleet with those thoughts. So, for example, if for soldiers coming back from Iraq and Afghanistan, they may see someone walking with a backpack down the street, which is common.
And that's a trigger for them.
And that may be a trigger because maybe there was an IED. Maybe there was a bomb that they witnessed going off in a backpack somewhere, or a bag that's left at a train station or an airport. We've heard of those things.
Right.
But the individuals that really read into those and think into those, that's usually someone that's had a traumatic experience with that before.
If we're talking about children and PTSD and a traumatic experience, they would experience the same type of symptoms?
Of course. They're little people. So they're going to have some of the same experiences. Say, God forbid, but say a child was abused with a broom. Every time they may see a broom, they may have that inclination, that thought, that fleeting thought of what can happen when someone picks that broom up. That's the same all the way up to an adult. Same with someone who's maybe had a car accident, or they've driven up to the same intersection that they always drive up to when they're on their way to work, and they see an accident happen, and they wonder, it was traumatic. Maybe someone lost their life, and they think, well, that could be me. They may actually avoid that intersection.
The mind is so powerful, isn't
Yes.
it? I mean, you can pull up to that intersection with the same scenario that you just described, and your heart will start to race, your mind will start to race. Are they all symptoms of PTSD?
Of course, of course. Now, they may not be as extreme for some people. They're not always, going to be life-changing PTSD, traumatic experiences that you could classify as PTSD, but they're going to be, there's mild symptoms. They may have that heart pounding, they may break into a sweat at that intersection every time because they can associate traumatic events with that location or those vehicles, that place and time.
So we are getting ready for a break, but before we do, I just wanted to make sure when we come back, we will be talking with Dr. Duane Boggess from East West College of Natural Medicine. Tonight's topic is post-traumatic stress disorder, and we'll be talking about how someone might have symptoms of PTSD but not know that this is their diagnosis or this is what they might be experiencing. So we'll talk a little bit about that and what you might do to a patient, with the patient when they come in, how you might talk to them and find out a little further what some of their experiences might be.
Right.
So we will take a break now. Local Doctors on Call will be right back. Thank you for joining us.
Hello, I'm Dr. Misha Payan, President of East West College of Natural Medicine. For over 20 years, we've been helping our patients improve their health and, more importantly, maintain their health by using Oriental and Western medicine. Many of our patients refer to us as the best-kept secret in Sarasota. Call today to schedule your consultation or for more information regarding our program in Oriental Medicine. East West College of Natural Medicine. It's not a secret anymore.
Hi, I'm Dr. Stephen Wrench, Dean of Clinical Sciences at East West College of Natural Medicine in Sarasota. Our approach to wellness using Oriental and Western medicine is often referred to as complementary, alternative, integrative, or even holistic medicine. We like to think of it as simply medicine. Call East West College of Natural Medicine today to schedule your consultation or to learn more about our program of Oriental Medicine.
Welcome back to Local Doctors on Call. I'm Suzanne Lee. I'm joined by Dr. Duane Boggess from East West College of Natural Medicine on Tamiami Trail in Sarasota. Tonight's topic is PTSD, post-traumatic stress disorder. And Doctor, we were talking before the break. Is it possible that someone would have PTSD and not know it?
Yes. That's actually one of the biggest problems that people run into is they don't know how to identify with a traumatic experience that maybe they've had in the past and how it's affecting them now today. The car accident we were talking about. You know, when people feel that nervousness at that intersection, maybe they start avoiding that intersection. They avoid certain things that may cause more trauma associated with the things that were there, like the vehicles or the traffic. So yes, they may avoid them but not know it. So subconsciously they're protecting themselves. They start to build walls up. So these traumatic experiences can't happen again. So they avoid certain things, and they avoid certain circumstances as well. When it's maybe abuse, verbal abuse or physical abuse, you know, they start avoiding people. They start avoiding places. They don't want to have a confrontation with anyone anymore. So they start to internalize and protect themselves. And it's what we do as physicians is try to bring that out of the patient. We try to ask them what maybe has happened. Why are they depressed when they come with depression?
But people don't know the answer to that sometimes, right?
Right.
So what happens when they come and see you? How do you help them realize what might be going on?
Well, as far as Oriental medicine, being an acupuncture physician, we do really intense intakes. So we're asking patients about maybe traumatic events. We're talking about their full history. So have they ever had any surgeries? Have they ever been in a car accident? Have they ever been in the hospital? What exactly has happened throughout their life? And usually without the patient really knowing, they're already revealing all these things. So it's very common. Usually patients are always coming to you and they've either got pain or they can't sleep, so they're having insomnia. You know, there's different things that we start to see that are red flags within a patient's history. And that's how we start to see the full picture of the patient, not just treat maybe their insomnia or panic attacks or anxiety, but we're actually pulling all this history out when we do our intake forms.
Does PTSD actually get worse over time if it's not treated?
Oh, absolutely. Yes, of course. Like when you start avoiding things, when you start avoiding those traumatic places and events, you start to cancel out parts of your life.
What does that mean?
So you start to essentially get like tunnel vision. You start to block out things that become traumatic or possibly traumatic or maybe trigger an event. And people they identify with that with anxiety. So they start to feel anxious about certain situations, maybe car rides or going to visit mom and dad or anything that might have had a traumatic tag on it somewhere. If it goes untreated, they start to even narrow their life down even more, maybe to less activities. When it comes to hypervigilance, we hear this from veterans all the time. I can't go to places where there's lots of people or loud music, or I can't go watch the fireworks anymore. Cars backfiring, you know, so public areas start to really they become they become a place that people want to avoid.
And I was just going to say they can go, but they choose not to go because they feel the symptoms coming on. Is that what's
Right.
happening? So their heart might race or they might become anxious.
Or angry. Yeah, that's the other reaction. Either they become very anxious, or you notice that people start getting fidgety and angry. They start to snap out. Especially you've noticed when people don't want to do something, you're with a group of friends. Let's all go here, and you got the one friend that's like, I don't want to.
Debbie Downer?
Right, exactly. So, you know, it's those kinds of things that you can start to identify with other people. Maybe why are they avoiding something? Why does that friend not want to go out anymore? It may not be that they're trying to avoid a busy place or busy people, but maybe they're trying to avoid the fight they may come home to.
Okay, now that's interesting. I think what we're trying to establish here tonight on Local Doctors on Call is how does acupuncture help in alleviating some or all of these symptoms?
Acupuncture is really effective because what we can do is we can start to treat the mind and treat the body as a whole. A lot of times our patients, like you mentioned earlier, they don't really know maybe what's triggered the anxiety, the depression, the anger, the hypervigilance. So we don't always have to bring that stuff out of the patient to start treating them.
Okay.
So in other words, acupuncture, we don't have to dig up the old past, the traumatic experiences, make a person relive it to start to heal them. We can actually go in and help the mind and body relax and calm down, especially when people have anxiety problems or insomnia. That usually is a tag on to PTSD.
So then with acupuncture, do the layers then start to peel back?
They do.
What happens there? To explain that.
Well, what happens, like, the patients always come back and they say, I don't know what you did on the treatment, but I slept so good that night and maybe even the next night. You know, sleeping is healing. We sleep because the body needs to heal. So sleep is always the first layer, the first thing we get to. If you can get somebody to sleep, and that's across the board in every kind of discipline in medicine, meaning everybody knows that your medications do not work. They're not effective if the patient doesn't sleep. A lot of people don't know that. So they're taking their medications all the time, and if they're not sleeping, they're not healing. Medications don't even actually work very well, if not effectively at all. So that's the first step, sleep. And next, we might start to see some emotional releases, what we call an emotional release in a treatment. That's where someone is overwhelmed with an emotional feeling, but they don't know why. I've literally walked in on patients after I've, put the needles in amongst all the fear of needles.
And they don't hurt, by the way.
They don't hurt.
We've done this before. They
Right.
really don't.
No. They're tiny. They're hair-like. So it's not going to be painful. But after I've started the treatment, I would go in and check on the patient, and they've had big tears rolling down their face. And I say, "You okay?" They say, "You know what? I'm fine. But I don't know why, but I just keep crying." This is a very common thing. It's something that we're actually taught this in school, that this may happen because we're not doing anything to the individual. Acupuncture is just allowing the individual to start to heal themselves.
So is that what is happening there?
It is.
So that is part of the healing process.
Right. And that's where we come into the natural part, the holistic part of this medicine, is we start to help the body heal itself without any outside influences. So in other words, we don't use medications like what you would think of pharmaceutical medications. We don't go into that. In fact, it's not even in our scope of practice to use pharmaceutical medications. That's why we can only use herbs. But pharmaceuticals have so many side effects. A lot of times, people are given medications for PTSD based on either their depression or their anxiety or their aggression. And then the physicians have to see how that medication affects that individual. So it's not a natural way for the body to heal like what acupuncture can do.
So what happens when you have the two treatments going on? We have just a minute here before the break, but so you're starting acupuncture, but the patient may still be on medications given to them from their other doctor, shall we say, their traditional doctor.
Yes.
Do those medications then slowly start to go away? Do you feel that there is less need for them? Does the patient feel that there's less need for them?
It's a good question. Most of the patients that come to us are on medications, and they're from their Western physicians. We never tell them to stop taking their medications. And acupuncture is still going to be effective, even though they're on medications. So a lot of times we use them together. That's the integrative part of the medicine.
Let's pick this up after our break. This is very interesting because I think sometimes people think, well, my Western doctor gave me A, B, C, and D, and maybe I should keep taking that, and we'll talk more about that after the break. My guest is Dr. Duane Boggess from East West College of Natural Medicine on Tamiami Trail in Sarasota. We'll be right back to Local Doctors on Call.
Hi, I'm Dr. Stephen Wrench, Dean of Clinical Sciences at East West College of Natural Medicine in Sarasota. Our approach to wellness using Oriental and Western medicine is often referred to as complementary, alternative, integrative, or even holistic medicine. We like to think of it as simply medicine. Call East West College of Natural Medicine today to schedule your consultation or to learn more about our program of Oriental medicine.
Hello, I'm Dr. Misha Payan, President of East West College of Natural Medicine. For over 20 years, we've been helping our patients improve their health and, more importantly, maintain their health by using Oriental and Western medicine. Many of our patients refer to us as the best kept secret in Sarasota. Call today to schedule your consultation or for more information regarding our program in Oriental Medicine. East West College of Natural Medicine. It's not a secret anymore.
Welcome back to Local Doctors on Call. I'm Suzanne Lee, once again joined by Dr. Dwayne Boggess from East West College of Natural Medicine on Tamiami Trail in Sarasota. Tonight's topic, PTSD, post-traumatic stress disorder. And doctor, we're talking a little bit about the integration of medications that you might currently be on from your Western physician incorporated with acupuncture. And my goal, just this is me personally, I can't speak of course for any other patient, but my goal would be to want to come off some of those medications. So if I were to come in and work with you and start my acupuncture, do you believe that I might feel better and be able to come off some of those medications? What can you share with me about that?
Well, what I can say is most patients do come to us and they're on medications. And that's why they're there. A lot of times patients come in and they say, okay, I'm taking 15 different medications. I need to find something else that's going to work because I can't keep doing this. Or maybe they can't afford to keep doing this. So
it is expensive.
It is. It's very expensive. And, you know, with all the different insurance changes going on, people are changing policies back and forth. So we're finding more patients are coming in because they can't afford it. They can't afford to take the medication, so they're looking for the alternative, right? So that's a very good question. Patients do come in, they are on medications, and we work with them because that's also a part of what we do is we work with people on medications. Maybe they're on medications they have to stay on permanently for whatever pathology or condition they may have. And of course, we know they're going to get better. That's why we do it. We're going to make them more comfortable. We're going to start to curb those anxiety problems, the depression, the anger, the sleep. We start to help all those things with the medications that they're already taking. And what we see is a lot of the physicians, you know, the patients are going back to their general practitioners and they're saying, I'm doing so much better. You know, and they have to be reevaluated.
I was just going to ask you, are all treatments the same for PTSD patients?
Absolutely not. No. Everybody is so different. Take, for example, myself. When I was in the military, I was there with another gentleman. He was my battle buddy. That's a common military term that we use. And we were in combat together. When we came back, I went with more of a depression and anxiety. His was more anger. So, and PTSD associated anger signs and symptoms there as well. But no, the treatments would be totally different for myself and him. You have to customize every treatment based on each patient.
So are there herbs and other natural remedies used in Oriental medicine which might be included in some of the treatment for PTSD?
There are. Along with the different types of treatments, there's different types of herbal formulas that we have to treat those naturally. And they would be customized for that patient. So I couldn't say that this formula is going to work for this patient and also work for this patient. That's usually impossible. When it comes to Oriental medicine, Chinese medicine, everything is so customized that no one patient is alike.
Okay, and the genetic profile, am I saying that correctly? Is that part of your determination in what herb or remedy might work?
Or nutritional supplements, yes, of course. When we're doing our lab work, when we're doing our genetic testing, we're looking at those things that are needed, whether it be a nutritional supplement to balance out, you know, the internal system, whether it be an herbal formula to balance out other things that may be popping up with that individual based on what their signs and symptoms are.
So if a patient comes to see you at East West College of Natural Medicine, they have to be prepared to give the time that you need because
Yes.
Let's face it, we go to the doctor, sometimes we're annoyed that we have to wait a long time and the doctor will only see us like that. You know?
Right.
He's in and out in just a few minutes. This is actually going to be the opposite.
Yeah, this is total opposite. When you come to see us on your initial visit, the very first visit, It's going to be at least an hour. It can be up to an hour and a half. It really depends on the individual, because sometimes with more complex cases, we have to dig deeper. We have to pull more history out of that patient, to figure out and start to paint a picture of this individual and their life, where they've been, where they are, and where they're going. So we need to get them on the right track, and that takes a long time, and that's how we're trained. We have to do a really intense intake, and we spend a lot of time with the patients.
So then with treatment for PTSD, how many sessions might be involved?
It really depends on the case. It depends on patient compliance, for one thing. When it comes to PTSD, a lot of things are involved. Some addictions, some abusing certain things.
Well, they're used to covering.
Yes,
And
they're
masking.
self-medicating. It's called self-medicating. Yeah, it's either drugs, alcohol, overwork, workaholics, people who avoid reality, video game players. They get lost in TV, movies. So every treatment is different because everybody's so different. If you were to say it's all going to be over and okay in 5 sessions, I would that's crazy. 10? No. What we do is we start treating the patient and we start teaching the patient how to live a healthier life and how to understand what they're dealing with. PTSD is something that the individual has to understand is it's never really going to go away, but we learn how to manage it. And when we learn how to manage it, then things start to get better, because understanding is knowing. We understand what's going to happen, and then we know what to do.
Does the clinic offer discounts for veterans as well?
They do. They do. There are veterans discounts. Just give us a call at the college. Carrie is our clinic manager. The college number is 941-355-9080, and you'll get a prompt when you call in that will ask you if you want to talk to the clinic, and you push that button. You let them know that you're ready for an appointment, and Carrie will give you all the discounts and pricing.
Okay, all right. And be prepared, as we talked about just a little bit ago, to spend some time with Dr. Boggess or another doctor there at the clinic.
Yes.
You're going to need to share a little bit about yourself over time if you want to heal and get better. Is that a fair statement?
That's a fair statement. We have to retrain you, teach you how to deal with this and how to manage it.
All right.
And it takes time.
Thank you for joining us for Local Doctors on Call for Dr. Dwayne Boggess with East West College of Natural Medicine on North Tamiami Trail in Sarasota. I'm Suzanne Lee. Good night.